Hi everyone, I'm Brandi Clevenger,
Hi, I'm Suzanne Kopeski.
and we are the leadership team at the Family and Fibromyalgia program with the International Support Fibromyalgia Network. We wanted to give you a quick overview of the program, but first we wanted to tell you how Suzanne and I met and how our visions aligned for this program. I am the creator and founder of the blog Being Fibromom, and Suzanne is the creator and founder of the blog Fibromom Blog. We somehow kind of met through all of it, and we started talking about our vision for a program, and we realized that they really aligned. And so I was super thrilled when I found out that we were going to be working together to help create this really important program for the Support Fibromyalgia Network. So first, I'm going to talk a little bit about why I think the program is important, and then Suzanne is going to talk about why she believes the program is important. So my vision for the program is to really help be able to get a better communication between family members. As we all know, fibromyalgia doesn't just affect one person, but rather the entire family. I also wanted to make sure that everyone's needs were met throughout the program and have a better understanding of fibromyalgia in general. So not only do we understand it better, but our loved ones understand it, and we can better communicate with our support system, with our medical providers, and be able to really help families in need. Suzanne, what are you looking for in the program?
Well, first of all, everything you just said, that's a real driving factor for me, but also building community and helping those with fibromyalgia and their families feel less alone. Um, our mission statement for the Families and Fibromyalgia program is to is developed by fibromyalgia patients to establish a support system that will include education, resources, and community services. Our support system includes parents, teens, young adults, caregivers, and men, but for the youth, it also includes their school community. Social support is essential in the physical and mental well-being of everyone from childhood to adulthood in order to lead healthy, functioning lives. We will carry out our mission through research, educational resources, community service such as events, workshops, and other activities, and advocacy training. The Families and Fibromyalgia program will collaborate with families, local communities, schools, researchers, and medical experts.
Yes, absolutely. We thought it was extremely important for any program to have a mission statement, but especially with the families program, because we didn't want, just to go out there and do whatever. We have goals for the program. We want to accomplish things with this program, and we wanted others to know what our vision and our goals are for this program. And what better way to say it than through a mission statement, just show action. I'm all about action. Awareness is great, but action is even better. And we really want to get our families out there, get them that help that they need, and be able to connect them with other people. So Suzanne and I worked together with creating some principles, some guiding principles of our program and how we're going to carry out that mission statement. So we're going to go ahead and read those principles that we went ahead and created. So for the first one, bridging communication. This is extremely important for me because this is a lot of what I lacked when I first got diagnosed with fibromyalgia. So the first principle is bridging communication between fibromyalgia patients and their loved ones to gain a better understanding of fibromyalgia and ensure everyone in the support system is being heard. This encourages open dialogue to openly address everyone's physical and emotional needs without feelings of guilt, shame, or judgment, resulting in stronger relationships. That is super important because, as I said before, it's not just me that has fibromyalgia. It affects the entire family, and it's not just my feelings that I need to be heard. I need to make sure that my kids' feelings are being heard and make sure their physical and emotional needs are being met as well. Because again, it's not just all about the person living with fibromyalgia, it's about everyone in the support system. The next principle is fostering advocacy by teaching patients how to cultivate self-confidence and develop an empowered voice to effectively advocate their needs to their support system and medical providers. This will allow a more collaborative care plan with medical providers. This is also super important to Suzanne and I. We were just talking last week when we were having a meeting about these principles, about how we both feel like we're not being heard by our medical providers, and it's no one's fault. We just need to know how to be able to do that. Suzanne's going to go ahead and pick it up with the last principle.
Exactly. Thank you, Brandi. The last principle will be about creating a community, both locally and nationally, where fibro families can connect and utilize resources that are readily available. Resources range from integrative to alternative care, as well as mental health. This one is hugely important to me also because I feel like there's so many of us that get diagnosed and then you just kind of, okay, you have it, and now what? So that's the gap we're trying to bridge there. We'll be carrying out the mission statement with monthly webinars, workshops, and question and answer sessions with various experts. In February, we will begin with how to navigate fibromyalgia with your partner. This will be Tuesday, February 25th at 10 a.m. Pacific Standard Time. So mark your calendars for that. Just to give you a little bit of information on this workshop, it is to learn to facilitate communication within the relationship so everyone feels cared for and, like Brandi said, heard. Brandi, do you want to touch more on the other workshops?
Yes, and Suzanne, you forgot to mention that you will be actually leading that workshop. That's super important. Suzanne is going to go ahead and lead that first workshop, and Suzanne and I have so many other ideas. I really thought we were just going to be on the phone for like an hour or two last weekend, but I should know better. Suzanne and I get together, and it's just, we have so many ideas. It's like we were on the phone for how long? 4 hours last week?
It was something like that, yeah.
And it felt like it went by like that. We always have a great time. We went to Fibromyalgia Advocacy Day together. We were roommates, and we were just talking about all these different program goals and things that we hope to accomplish. We were talking about different workshops. We have so much in store. It is absolutely amazing. So some other things that we're going to have for the rest of 2020, we're going to teach about proclamations, why they're important and how to do them for your state. We're going to have motivational speakers, other fibromyalgia bloggers sharing their stories. When we go back to school, we're going to have something for back to school. We're going to be talking about advocacy, nutrition, stress management, most importantly, how to balance fibromyalgia and family, because that's super important. So right now, Suzanne and I are in the process of creating a Facebook group, so that way we can not only share information on the Support Fibromyalgia Network Facebook page, but also within the group. And Suzanne, I got to see her workshop. It's phenomenal. You do not want to miss it. But she's going to have some activities and some worksheets, so we'll be able to upload it to that Facebook group. So when it opens up, stay up to date on the Facebook page, and we'll let you know when that Facebook group opens up, so that way you can go ahead and join that Family and Fibromyalgia Facebook group, and you'll be able to get all that information. We're going to go ahead and wrap it up. I know this wasn't super long, but we didn't want to bore anyone, but we also wanted to keep everyone informative on the program. So if you go to supportfibro.org, at the very top of the menu, browse the website, absolutely. Go and look at everything that's on there. It looks phenomenal. But at the very top, you'll see programs in the menu bar. If you want to click on that and then click on patient services, you'll be able to see our Family and Fibromyalgia program on there. You'll be able to see the program overview. We'll put our mission statement up there here in the next couple of weeks. And you'll also be able to see pictures of me and Suzanne, as well as our other part of the leadership team, Melissa Swanson. So just to close out real quick, Suzanne, do you want to go ahead and just one more time put a plug in for next month's webinar?
Yes, before I do that, I do want to note that some of our workshops will be done live, and some of them will be done live for the public, and some of them will have limited seating. So make sure you're keeping up to date on when these workshops are happening in case you need to sign up, and we'll have limited seating, so you'll want to be the first to get in. Again, don't forget Tuesday, February 25th at 10 a.m. Pacific Standard Time, we will be having the first workshop, How to Navigate Fibromyalgia with Your Partner, and that will be done by me.
Yes.
So I'm super excited about it. I hope everyone will join us.
Yes, so and if you have any other questions, just send it over to us and someone from the team will get back to you as soon as we can. Thank you so much for watching this video, and we hope everyone has a great day. Bye-bye.
Bye.